In this video, let's take a look at one of the rare but important renal disorder, that is Fanconi Syndrome. Don't confuse this with Fanconi's anemia. It's a totally different condition. Fanconi Syndrome is a defect in the proximal coronary tubule. It leads to impaired reabsorption of several key substances that are normally passed in the urine, but it will be reabsorbed back again. So to understand this syndrome better, let us first understand what is the normal role of proximal coronary tubule. So you can see here, this is a filtrate which is formed by the glomerulus, and the filtrate, when it is passing through the lumen of the proximal coronary tubule, many important substances gets reabsorbed back into blood. So in the filtrate, there will be a lot of sodium, glucose, phosphate, amino acid which will be present in the lumen that needs to be reabsorbed back into the blood, and some waste products from the blood needs to come back to the lumen. That is, the secretion process should take place. So from the filtrate, now you can see here, sodium gets reabsorbed in the proximal coronary tubule in exchange for H plus ions. So hydrogen ion is secreted into the lumen, sodium is getting reabsorbed back. So this transporter is sodium hydrogen counter transport, because they are happening in the different directions. Also, we have another transport, that is sodium glucose co-transport, meaning both sodium and glucose will enter into the PCT cell and then goes back to the blood. So otherwise, sodium phosphate co-transporter or sodium amino acid co-transporter. So you can see here, sodium is reabsorbed, glucose is reabsorbed, phosphate is reabsorbed, amino acid is reabsorbed. Along with that, here sodium and glucose are osmotically active particles. So when these substances are reabsorbed, remember, water also is reabsorbed back into the blood. So in Fanconi syndrome now, if PCT, the cells are not working properly, so what will happen is all these molecules, especially sodium, glucose, phosphate, amino acid, along with that water, will be lost in the urine. Okay, and H plus ion, which is supposed to be secreted back into the lumen, it's a waste product, it's a byproduct of metabolism, right? This H plus ion is not getting moving in the lumen, so it will be accumulating in the blood. So what happens is, there is acidosis, because hydrogen ion is not secreted, so hydrogen ion accumulates in the blood, leading to acidosis. Sodium is not getting reabsorbed, so sodium will be lost in urine. There is glucose, amino acid, all the important nutrients are not getting reabsorbed back into blood, so the baby will have failure to thrive. Phosphate is not getting reabsorbed, so phosphate is needed for proper bone formation, right? So the bone, it will become a problem, and also for proper cognition also we need phosphate. Okay, so patient can have cognitive issues also. And sodium, glucose are all osmotically active particles, so if they're not reabsorbed, if it is going in the lumen, water is also retained, so that will lead to like polyuria, patient can have a dehydration and all. So how do I remember this Fanconi syndrome better now? You can remember this mnemonic, Fanconi itself. Okay, F stands for, main thing is failure to thrive. Baby is not able to grow properly. There's a growth retardation happening, and there is amino acid in the urine, amino acid urea. All electrolyte imbalances will be there because sodium is lost, potassium is lost. Cognitive issues or bone diseases will be there due to phosphate loss mainly. O stands for osmotic diuresis, because osmotically active particles are lost and that will draw water along with that. That's why we call it as osmotic diuresis, which further leads to polyuria and dehydration. And remember, when you test the blood glucose level, it will be a normal blood glucose level. Despite that, there is glycosuria, because usually in diabetes mellitus, what happens is there is excess of glucose, so it will be lost. But here, glucose in the blood is normal, but even then glycosuria is there because there is impaired reabsorption of glucose. And since there is an acidosis, it is an increased acid in the blood, that is type 2 renal tubular acidosis is noted, which is a type of chronic acidosis, because hydrogen ion is a waste product, it starts accumulating in the blood, but it is not secreted out. So this is a main problem in Fanconi syndrome. So remember, Fanconi syndrome means it's a problem in the PCT, and PCT normally helps in reabsorption of majority of the important substances. Almost like 65 to 70% of reabsorption happens in PCT. So the PCT becomes defective, so reabsorption process is affected, and that is why the baby will have failure to thrive. Thank you.